Still setting up. Now, is it supposed to be? Live stream, it's coming. Okay. Okay, I'm going to press broadcast. Still setting up. Oh, people are already in. Hi, everybody. Welcome. People are coming in quickly. Now, is it supposed to be? Live stream, it's coming. Okay. Okay, I'm going to press broadcast. Oh, people are already in. Hi, everybody. Welcome. People are coming in quickly. I'm just going to see if this is broadcasting onto YouTube. Live stream, it's coming. We've already got 64 people. Welcome, everybody. You've already come in a bit early, so I'm going to give it until 8 o'clock just to start, and hopefully we're also live on YouTube as well right now. Please start sending in your questions to the Q&A. Okay, welcome everybody that's joining. We've got 80 people now, so I'm just going to wait till we get up to everybody being here. I'm going to give it a couple more minutes and then we will start sending in your questions, and there's also a chat if you want to say anything or mention anything to us, then feel free to send them in there. And Leah, another one of my co-founders, is on here with me and will let us know if there's any issues. Okay, I can see the first question starting to appear, so please do keep sending those questions in, and I'm going to get started in just a minute. Okay, we are going to get started now. So welcome everybody to this webinar. We are the Birth Collective, as you might have heard about us already, and this is a 4-part series now. This is your lesson 1, and I'm here today to talk about what you can expect from your labour when you're most likely going to be giving birth during this coronavirus pandemic, and I'm trying to just give you some tips to help make it the most positive experience that you can, and obviously to answer any of your burning questions. We've got an hour here, so I'll run through in a second what we'll be planning, but in case you don't know me, my name is Brooke. I am an obstetrics and gynaecology doctor, and I'm one of the co-founders of the Birth Collective, which we basically created because we want to keep sharing information like this. We want to help to give you evidence-based information about pregnancy and about birth, about actually what you can expect, giving you high quality information, not kind of rubbish that's hearsay, but we all 3 of us work on labour wards at the moment, and so we do know exactly what's happening on the ground. So this is my plan for the session. What we're going to do is I'll start off by talking about the main risks of coronavirus in pregnancy and in labour. Basically, it's what we know so far. So we are talking today, it is the 7th of April, and everything that I'm going to be talking about is correct up until this point. As we know, the evidence is changing all the time when it comes to this issue. So I'm going to tell you what we know so far. I'll also give us a little bit of an idea about what the impact is going to be of this pandemic on maternity services. So not just about how coronavirus could affect you if you get it, but also how it's affecting the bigger picture and what your experience might be. I'm going to talk a little bit about the birth partner, whether they can or can't be there, and also what role they can play. A little bit about when to go to hospital. And then finally, I'll just talk to you a little bit about your birth preferences, about what you can actually choose, what things you can do to make this a more positive experience. I'm planning to talk about all of these things for about half an hour, and then I will start taking your questions. If you're following with us on YouTube, you can send questions into the comment section there as well. Okay, so if any of you haven't used Zoom before, you're not that familiar, we've got 100 of you. Yeah, we now have 100 of you here on Zoom with us, and we are also live streaming to YouTube, and we're recording this session for anybody that isn't able to be a participant here. If you are watching on Zoom, you can start sending in your questions on the Q&A. You can also vote on the questions that you can see. So if you've seen one that you quite like the sound of, you'd really like me to answer it, you can like it, and that will push it to the top of my list. And you can comment on those as well. So we'll be taking those questions at the end. And there is a chat as well. Yeah. Everything that I'm talking about here today is based on mainly the UK guidelines, the RCOG, the Royal College of Obstetricians and Gynaecologists, who have been actually brilliant at bringing out some guidelines and explaining the evidence. It is mainly UK focused, but I also have got an idea about what the American guidelines are. So I'm going to try and keep it pretty broad, as I know some of you are tuning in from other countries, but just be aware that this is mainly UK focused. Bit of a disclaimer, just remember that all of us in the Birth Collectors, we are health professionals. We are not familiar with you and your own situation. So whilst I'm trying to give you general, useful, relevant advice, it is not personal or specific to your circumstances. So nothing I'm saying here can replace, having a proper consultation with your doctor. And I know it's difficult to speak to your own doctors at the moment, but you do need to try to speak to someone about your own specific circumstances. Okay. So what do we know so far? You've probably all heard this message, especially if you're in the UK, over and over again. Coronavirus, stay at home, protect the NHS, save lives. So please stick to that message, stay home at the moment. That's a really important factor. If you're pregnant in the UK, you'll have been classed as part of a vulnerable population. The best thing you can do to protect yourself is to stay at home and come into contact with as few people as you can. Okay, so what coronavirus is, you've probably heard the word now millions of times and you're sick of it. So this coronavirus is basically part of a family of viruses. It's the same family of viruses which SARS is from, which you might have heard of a few years ago. And all these viruses cause a upper respiratory tract illness, which is why the symptoms tend to be things like a cough and a fever. They're the main things that we hear about. But I think the thing that everybody here wants to know is, will it affect me? How will it affect me? Is it relevant to me specifically? So we know that in pregnancy in general, you are more vulnerable to getting infections, and sometimes, especially in late pregnancy, those infections can be severe. And because you've got a baby on board, we worry about the effects it could have on you and on your unborn baby. So that's why you're warned about the flu, you're offered the flu vaccine, for example. However, when it comes to coronavirus, as far as we know, as of today, we do not think pregnant women are any more at risk than the general population of either catching the disease or of getting a more complicated form of the disease. So that's good news. If you were to catch it, because you can still catch it, and you were to develop complications, the main complications we think about is pneumonia and getting respiratory distress. But those, remember, are extremely, extremely rare. And the vast majority of you, if you were to experience this illness, would only get, mild or moderate cold or flu-like symptoms. So you don't definitely need to go into hospital if you start to develop these symptoms. All you need to do is isolate, take paracetamol, and just look after yourself, eat well, and wait for it to pass. However, of course, if you think you're getting the complicated side of it, then definitely do seek help, and don't be afraid to use hospitals and the medical services at the moment. Okay, next question I'm sure you're all wondering is, if I got this infection, will it affect my baby? Again, reassuring so far. At the moment, there is no evidence at all to say that having this infection at any point in your pregnancy will increase the likelihood of having a miscarriage. However, similar viruses, there has been a suggestion has been associated with, for example, with SARS, but even that evidence was not conclusive that having that infection increased your likelihood of miscarriage. So at this point, nothing to worry about there. And there's also no current evidence that getting this virus will cause any developmental abnormalities. So especially if you're earlier on in your pregnancy and you were to catch this infection, at the moment we don't believe it's going to cause any problems in your baby growing. There are some things that we've seen that we have to keep a close eye on. So we noticed in China, from the babies that have been reported, there have been some babies that have been more likely to be born prematurely, so early than they were supposed to. We don't fully understand why. We don't know if it's because the mum got unwell, so the medical teams looking after them had to advise delivery, so it was them intervening and causing early birth, or if the virus itself did, but that will come out over time. And the other thing there's been a little bit of a concern of is whether or not it could affect the growth of the baby kind of in later pregnancy. It's the reason that in the UK, if you were to catch this infection and it was confirmed, you would have a follow-up scan just to check the growth of the baby a couple of weeks later. So if you have coronavirus, so an active infection at the time you come into labour, how is that going to affect your pregnancy? So the main thing at the moment we are concerned about is some women that have an active infection, probably because their body is fighting an active infection, that can increase the likelihood that baby could come into some distress during labour. So what that means for you practically is that if you had coronavirus, we would advise you to be giving birth on a delivery suite or a labour ward, and that's because there are obstetricians present, people that can monitor your baby continuously throughout labour, and intervene if there is signs that your baby is in distress. However, just having coronavirus, if everything is going to plan and you have that infection, but you're in labour and everything is going okay, having that infection alone shouldn't change what type of delivery you have. So if you already have a particular plan in place, we should be able to go along with that mostly. It doesn't mean that because you have coronavirus, you have to have a cesarean, for example. Another thing that you might notice if you were in labour and you have this infection is that everyone that will be coming in and out of your room, everybody that would be looking after you, would be wearing this PPE. We keep hearing about it on the news. There's a picture of lovely Leah from Birth Collective all dressed up in her gear when she was at work last week, and that's kind of what someone might look like if they were looking after you whilst you're in labour. Now, that's not a very encouraging or enjoyable thing to do. It's very difficult to communicate with somebody when you've got a mask on your face and all these layers of clothing. So it's just something to be aware of that will have a bit of an impact on your labour, but obviously that's for the staff to be able to protect themselves while you have an active infection. Okay. However, even if you don't have coronavirus, this pandemic is likely to impact your pregnancy at some point at the moment, and possibly when you're in labour as well. Now, remember that the maternity system is an essential service. This is considered, like A&E. We can't just turn it off. We can't just delay it and say, we're going to stop all elective procedures, come back to us in a few months' time. Because if you're pregnant, your baby needs to come out at some point. So don't worry, the system will be maintained. What that means is we'll still have on labour ward, for example, the same number of midwives and doctors. That is kind of a preserved set of doctors and healthcare professionals compared to the rest of the hospital, where doctors are being redeployed deployed to different areas. When it comes to maternity, we are kind of protected in that sense. So we should still have anaesthetists available to do epidurals. We should still have midwives and doctors to look after you. The numbers may change depending on the days and things like that. And of course, there's sickness within the teams. That's the main thing that's affecting staffing at the moment. But if you know, for example, you're having a planned elective cesarean section, that will still go ahead. It may change in terms of the day that you get, the time that you get, even where you have your elective cesarean. I'm aware of that happening in some hospitals. Because of the stresses on the system at the moment, they might be planning to have their elective cesareans in a different hospital to what you might be booked under. You may need to be just a little bit flexible, but it's not to say, you know, you're going to be told to come back in 6 months for your cesarean. Your cesareans need to happen, and they will continue to happen even during this time. During your pregnancy, some of your appointments may be changed to being virtual appointments or telephone appointments. And what that means is the person that's kind of doing the appointment with you, whether it's your midwife or your doctor, will have your details up in front of them, your medical history in front of them in your notes, and they'll maybe be making a telephone call to you. They'll be able to review your blood tests and arrange any scans or tests that are needed, but it avoids you from having to come into the hospital. So that's the reason some of them are changed to virtual appointments. And you'll also be told that you would need to come alone to your appointments. Now, what we're trying to do here is we're trying to reduce the number of times that you have to come to the hospital, so face-to-face appointments. And there's two main reasons that we're doing that. Number one is to reduce your risk of catching coronavirus. If you haven't had it already, of course, you're a part of a vulnerable population, and we want to look after you and the other people that you live with. So by reducing the number of times you have to come to the hospital, that hopefully would reduce your chance of catching the infection. And the other reason, of course, is also to look after the other healthcare workers and prevent them from contracting the infection from you. Because even if you might feel well at that time and you don't have a fever, you don't have a cough, you might be carrying this virus and you could pass it on to them if you're having extra appointments. So we will reduce the overall number of appointments, but they should be replaced with virtual appointments. But don't at any point let any of this affect you from seeking help if you need it. If you need to come to hospital, please come to hospital, don't delay. If you think you have signs or symptoms of coronavirus at that time, then please call ahead and try to take additional precautions if you can. Don't use an ambulance if you can. Wearing a mask would help to reduce the risk of you spreading it to other people. But otherwise, if your baby's not moving so well, you're bleeding, you have any concerns, please don't think to yourself, I can't go into hospital. Please still attend. And that's something that's really important for us at the moment. Okay. So I'm getting asked all the time, what's going to happen to my birth partner? Am I going to be able to have somebody with me during my labour? And I know that's something so many of you are worried about at the moment. So the RCOG, the Royal College of Obstetricians and Gynaecologists, who look after the UK system of maternity services and makes our guidelines, they have added in a line to their guideline to say that yes, we understand and we recognise that having a birth partner present is so important. It's obviously important for your overall experience. It's important for your mental well-being, and also for having a better birth because you've got someone there that maybe can help you to feel more relaxed and help you when things get difficult. So absolutely, we recognise that it's important. And so what they have suggested is that women should be permitted to have one birth partner with them during labour and birth. They have to be symptom-free. So if your birth partner has got a fever or a cough, please do not bring them to hospital with you. And that's because we do not want to spread this virus any further. So of course, they would need to stay at home. But otherwise, they can come in with you. They can come in from when you're usually in active labour and stay until after the baby's born. It's still a really difficult situation at the moment because, of course, if, for example, you're having an induction of labour and you're going to be in hospital for a day or so prior to the birth of your baby, of course you want your partner there with you. I completely understand that. But we are trying to protect the other women around and the staff by reducing the number of people on the wards at any one time and just keeping it to the really important moments. So from when you're in active labour, which is usually when we can when we say 3 or 4 centimeters onwards, up until maybe an hour or so after birth, and then your partner will probably be asked to leave. It may be different in different hospitals, but that's how it's working at the moment in the UK. But that could still change. There are hospitals I know that have banned birth partners entirely, and that's probably because their load of coronavirus is just so high. So anyway, we wouldn't be wanting to expose any additional people out there to that risk of contracting coronavirus. And we just don't have the PPE to protect ourselves from additional people. So at the moment, we're trying to keep the number of people to a minimum, but allowing you to have a birth partner. But I can't guarantee that won't change. And you probably should just discuss with your own midwife or your own medical team about the policy in your hospital, and recognize that even in a week's time, it might be a different policy, but you could check in with them. Okay. If you do have your birth partner there with you, there are some things that they can do to help you in this really stressful environment, as I completely understand it is at the moment, to help you to have a more positive birth experience. So first of all, thinking about when you're in established labour, that's the point at which they are with you. So they can help you to assist with your relaxation and your comfort measures. So Karen tomorrow will be taking you through hypnobirthing, and that's fantastic techniques in order to help to tap into relaxing yourself, calming yourself when everything feels really stressful. They can help to offer you drinks and snacks to remind you to stay hydrated is so important in labour, and also to stay on top of emptying your bladder frequently. It's something that it sounds obvious, but when you're in labour and you're having regular contractions, it can be really easy to forget to go to the loo, and they can help you with that. Honouring the silence. So sometimes you just need some silence. And I think if you've got a really good rapport with your birth partner, someone you feel very, very comfortable with, they can recognise that as well. They can help you to change your position. And the other thing they can do, especially at this time, if the person that's looking after you is having to wear PPE, they can help to translate what they're trying to say if you're finding it difficult to understand them or hear them because they're talking in a mask. And even actually if they're not wearing PPE, we know that during labour, and it's a stressful situation, you're having pain, it can be quite difficult to take in all the things that people are saying to you, especially when you're feeling stressed. So having somebody that's there that can just repeat what you're being told and maybe put it into different words so that you can understand, especially if there's any decisions that need to be made. Maybe they're telling you that we've got concerns about the baby, we might need to go, to do a cesarean or something like that. If they're trying to explain that to you and you're finding it stressful, hearing them or understanding them, your partner can help to translate those things for you. And mainly they can just give you positive encouragement, positive reinforcement that you're doing really well, that things are going in the right direction, that you're getting closer to meeting your baby. So that's lots of things that your partner can do if they're there for you. Equally, I think, remember that if your partner isn't able to be there, your midwife knows all of these things, and your midwife will also be able to do these things. If you know that your partner isn't going to be allowed in with you, maybe jot these things down on a list and bring in a list with you and say, these are the things I want you to try to help me with when I'm in labour, because that's what my partner would have done for me, but they weren't allowed to be here. If things slow down, one thing that's really, really important, try to mobilize. So if your partner is with you, they can help you to get up, maybe walk around the bed, maybe walk around the ward if you're in that early part of labour. But probably what you'll find at the moment is we're trying to restrict people from moving around too much, again, because we're worried about spreading coronavirus, even from people that we don't think have the virus, because we know that you could carry it without showing symptoms. We'll be trying to limit how far you can go. So it might just be walking around the room, but mobilizing or bouncing on a birthing ball will help your labour to progress if everything slows down and the contractions space out, for example. Again, helping you to relax you and giving you words of encouragement if things are slowing down. And then finally, when it comes to the point when you're ready to give birth, when you're 10 centimeters dilated, so you're in that second stage of labour and you're ready to push, they can help you with encouragement again to follow your urges and your sensations, to push together with your midwife or doctor, whoever's looking after you, reminding you to breathe. And they can also help you to have skin to skin straight away. These are only just some of the ideas around how your birth partner can help you. We do go into all of this in a lot more detail in our full antenatal course, and we cover exactly what I mean by kind of early labour, the first stage of labour, second stage of labour, and afterwards, as well as ways to have kind of a more positive experience at each point. So yeah, you should all have already received this, but there's a discount code if you do want to sign up to that full course, because I'm not, just for time reasons, not able to cover all the things that I would love to tell you about. But next thing that I want to talk about is about other things that you can be doing to help to give you some control over the situation, preferences that you may wish to note down. So first of all, thinking again about the first stage in that bit of labour when you are having contractions but you're not yet pushing. If you are feeling really stressed because of kind of the pandemic and everything that's going on around you, the atmosphere, video calling is great, and you can use that to interact with obviously your partner if they've not been allowed into your birth, or other people that are at home, maybe your mum who you would always have imagined to have with you during your labour, just video calling people. Again, using hypnobirthing, which Carrie's going to teach you about tomorrow. You can print out some affirmations to have around the room. We've been posting some on our Instagram, and again, there's a full set of downloadable affirmations in our antenatal course, and you can print those off and pop them around the room, or you can even just write your own, write some things that are things you'd like to read to encourage you during this process. Think about which parts of the environment that you could control, so certain smells, having lights or sounds, what you want to listen to, and even having some notes to read from your loved ones who again would have been with you but maybe can't because of this time. Having voice notes recorded on your phone just to play with their voice, that can be really helpful. Obviously, exactly what options you have available to you will depend on where you are, and it may not be possible to have all of these things, but these are some ideas that you can ask for. Then just thinking about the second stage of labour, so that's the pushing phase when you're 10 centimeters dilated. You could have your favorite music on. You can also ask to be the first voice that your baby hears if that's something that matters to you. There's often a lot of chatter around a birth. It's not always possible because, unexpected things happen, especially at this stage of labour. You may require an instrumental delivery. It's very common for first-time mums especially. Again, I don't have time to go into exactly why we would do an instrumental delivery or what it actually means in this course, but that's one of the reasons if, for example, we're doing an instrumental delivery, it may not be possible for us to be completely silent when your baby arrives. But if everything is going well and there isn't any concerns about your baby or for your own well-being, then you could ask that, at the time of birth, that everybody's quiet and that you could maybe be the first voice that your baby hears. You could ask for delayed cord clamping, which is always something that we do try to do, which is basically just allowing the cord to stop pulsating to increase the amount of blood that flows back towards your baby, which is really helpful. You could ask if you could be the first person to see the sex of the baby. So after the baby's born, if you don't know what you're having, that you could ask for them to show it to you rather than anyone saying, oh, it's a boy or it's a girl. And then finally, asking to have skin to skin as soon as possible. Again, it's not always possible. If your baby comes out and your baby is distressed for any reason, or we've been worried about your baby's heart rate, then they may take your baby and check your baby over at the incubator, or the paediatrician may have a closer look at your baby at the time of birth. But if all is well, then we definitely encourage you to have some skin to skin time straight away. And finally, in the third stage of labour, which is after your baby's been born, when we're waiting for the placenta to be delivered, you could be having skin to skin during this time. And you could ask your midwife to help you to start feeding your baby, especially if you're planning to breastfeed your baby. They can help to get you breastfeeding, and that can even happen during the third stage of labour or after the placenta is delivered. And then even more generally, after labour is all finished and your partner may be asked to leave, there's lots you can still be doing to have a more positive experience while you're in the hospital. And I think just remember this idea that you're all in it together. The other mums that are going to be with you on the postnatal ward, for example, you know, won't have their partners there either. They won't have anyone supporting them. If you're in a bay with other women, hopefully you can kind of look out for each other, offer words of encouragement, offer words of support or advice, and just that will make it a more positive experience for everybody. So those are kind of all of the things that I wanted to tell you about. As I mentioned before, I've not covered a lot of other things because it's just too much for this topic, and I want to get to answering your questions about the pandemic at the moment. If you want to learn more about labour, what to pack in your bag, about being induced, C-sections, instrumental deliveries, how to help yourself to heal after birth, your postnatal recovery, all of those kind of things are covered in the main course itself. So I'm going to just start answering some of the questions that have come on so far. Okay, so I will start with this one. So what to expect for induction at this time? Not going into too much detail over exactly what induction involves, but I think this question was asked by a lot of people after the Royal College brought out a new guideline last week about antenatal and postnatal care and what appointments you can expect to have. And one of the things that they did say was the 41-week appointment was being replaced so that you'd be advised at 41 weeks to straight away have an induction. Well, that's kind of how it reads in the guideline. So if you go past your due dates, what we normally suggest is around 42 weeks that you are advised to have an induction of labour, and that's because the risk of stillbirth does increase after that time. So to reduce that, we advise you to have an induction of labour to make sure your baby's born earlier than that. At this time, the actual process of induction, we're not expecting to change drastically. I think the guideline actually, what it was meaning to say was rather than having one appointment with your midwife where you discuss induction of labour and then you come back another time to start that process off, at some point between 41 and 42 weeks, they would advise you to have an appointment to come in to have an induction of labour, and they can discuss the process with you then and start it off straight away, thereby reducing the number of times that you have to come into hospital and expose yourself again. Yeah, as I say, induction will still be induction. It's unpredictable. It can take a bit of time, and there's different methods of induction of labour. But at this point, they're not specifically changing because of the pandemic. Okay. I'll take this question next. So first time mum, how to know when during the onset of labour to contact the hospital to attend to reduce the risk of being sent home or your partner being sent away. That's a great question, and it's really important now more than ever. What we would like ideally is for you to try to stay at home as long as possible. We always would like that in general, because in early labour it can be very unpredictable. So it's what we call the latent phase. It's a kind of a long process of getting your body to start making the changes that are required in early labour. And we know that being in your own environment can help that process to happen quicker. So staying at home longer will mean that you will be further along in your labour by the time you get to hospital. So the main time to come into hospital would be when you're having contractions regularly, because at the start they can be very irregular. So they should be happening regularly. So 2 to 3 contractions every 10 minutes. And the contractions themselves should be lasting for 60 to 90 seconds or so. So once that's been happening for a little while, then it's time to call the hospital and maybe to come in, because we would expect by that point you're in active labour. Or the other thing is if you just feel like you need pain relief, that's another sign maybe that your labour is progressing quickly. If you feel that you need help, you can't cope at home anymore, then again, coming in. There's a lot more on that, again, is covered in our main course about ways to help you to cope at home, techniques, pain relief, things that you can use. But generally what we'd be saying is try to stay at home as long as possible. Listen to your body. If the pain is becoming too much or you are concerned, so for example, your baby's not moving so well, you've seen any blood, you've seen any green in the waters when your waters broke, all of those things are important to come into hospital straight away. If you're in any doubt, call the hospital and call, in the UK, it's usually the triage you would call them, have a chat, and they'll be able to tell you if they think it's worth you coming in or not. So I'm just checking another question. Okay. If me and the baby are admitted for any length of time, my birth partner, will they be able to visit, or is it no visitors at all? At this point, different hospitals will be making their own rules. As I understand it from kind of speaking to people working in various different hospitals, mostly it's no visitors at all. We are making an effort at this time to get mums home as quickly as safely possible, of course, but probably no visitors. Now, remember, once you do go home, the advice is still no visitors. Of course, you'll be reunited with your partner at that time, but you shouldn't be having, members of the family coming round. You should be having no visitors at all. We're in lockdown in most countries in the world at the moment. We shouldn't be having visitors. I know it sounds like an exceptional circumstance, or baby's just been born, but you need to protect your newborn. You need to also think about protecting the other vulnerable people. So who is it that you want to come and visit your baby? It's probably your parents or your partner's parents, and they're probably a bit older, and they might have underlying conditions. And especially if you've just spent some time in a hospital because you've just come in to give birth, then that's all the more reason that you might be exposing them to additional risks of contracting coronavirus. So we would say no visitors in the hospital, and it's not a good idea really to have any visitors even after you go home. In terms of the birth partner specifically, that might vary in different hospitals. If you're in an area which hasn't experienced so much coronavirus, they might still be allowing partners to be on the postnatal ward. However, most hospitals are not allowing them at the moment. If you're still due in a few months, this is probably a rule that's going to change. We completely recognise that as much as possible, we would like to have birth partners with, with a mum, especially when you've just given birth. You're going to be trying to breastfeed. That's really difficult. And of course, midwives are very busy. They've got the babies to look after. They've got mums to look after. And having your partner there actually makes their job easier. So this is by no means something that we would like to keep in place for a long time, but it's all about right now just trying to control the spread of the virus and to reduce that as much as possible. So yeah, that's the reason it's a really difficult thing to hear at the moment, I know, but I hope that explanation is helpful. When it comes to like breastfeeding support, Stacey is going to be giving what I'm sure is going to be an amazing session on Sunday, where she's going to talk about actually getting support with breastfeeding in this pandemic time as well. Okay. So this question here is about water births. So from what I've heard, water births may be an option that's removed from labour ward due to the safety of mothers and midwives. Is this likely? This is something I'm very keen on for a positive birth. Yes, at the moment, again, it's not universal, so it doesn't mean all water births everywhere are not allowed to happen, but many hospitals are actually restricting or stopping water births altogether. The first thing is, if you have coronavirus at the time you're in labour, then water is not advised for your labour. And that is because we need to closely monitor your baby, because as I mentioned earlier, there's the possibility of your baby getting distressed during labour whilst you have an active infection. And therefore, we cannot safely monitor you whilst you're in the water. We can't safely and easily get you in and out of the water. So you wouldn't be able to have that if you have coronavirus at the time you're in labour. Now, even if you don't, water births are being stopped at the moment. We are deep cleaning every single labour room when we're changing them over, because it's possible that each mum might have had coronavirus, even if they don't have symptoms. The water pools take a long time to fill up, to clean, to empty. They can harbour infections. And not only that, the system is under a lot of pressure. Home births have been cancelled, so a lot of women some extra women are coming into hospital that maybe would have had birth outside of hospital. So the pressures are higher. And so, yeah, most water births across the board have been stopped at this moment. As I say, there are so many different ways to make sure that you have a positive birth. There's loads of different options for pain relief. We've got a whole lesson on that in our course. And when we go into all the different options of pain relief, water is great, but I would say there are other things that can be really useful that you absolutely can have at this time to help you. And also hypnobirthing is really great in this situation as well. It can help to reduce your experience of the pain and also feel in control over the situation, and that you can have a more positive birth. So this question about whether birth partners can stay for the golden hour. So the golden hour is that first hour after your baby's been born, and we absolutely would like to keep mums and babies together at that point, and we would hopefully like your partner to be there with you. We call it the golden hour because it's really important for bonding and to have that first feed in the first hour if possible, with lots of skin to skin time. And so ideally, yes, we would have, that would be the point at which your partner can be there, enjoy some early cuddles, lots of photos, and have a bit of time to spend with the baby. But then after that, kind of an hour or two, they'd probably be asked to leave. I can't guarantee they won't be asked to leave earlier than that, because it will be different in different hospitals. But at the moment, as I understand it, yes, the intention is that they could be there for kind of an hour or so, and it would be really when you'd be being moved to the postnatal ward, they'd probably be asking them to leave. But that it's another question that's worth asking your own hospital. Okay. So this question here, I hope I answered it a little bit earlier, but it says, I've heard the birth partners are able to attend during active labour. Please, can you share more about what this means, first pregnancy due in 10 weeks? So that's kind of what I was saying earlier. Active labour is from when you're around 3 to 4 centimetres onwards until after the baby is born. And that consists of a first stage, a second stage, and a third stage. The reason they can't come earlier is that the earlier bit is basically very unpredictable. That's the latent phase, and that can go on for hours to days. We're trying to reduce the amount of time that additional visitors are spending in the kind of labour wards or delivery suites. So that's the point at which they'd be advised to come. So from when you're 3-4 centimetres onwards, basically. Okay, this question is about how the pandemic is affecting postnatal care, both on the wards in hospital and midwifery care in the community once you're at home. That stuff is definitely going to be covered by Stacey on Sunday. She's actually, I don't know if you follow her on her social media, she's Feed, Eat, Speak on Instagram. She's actually been putting out a question on her stories today, asking people to send in their experience. So not only is she actively working at the moment as a feeding specialist, but she's also trying to gain information about what's happening in all different hospitals in all different places. And I know that she's been in touch with health visitors and midwives in the community to be able to give you a really good update about exactly what is happening at this time. So I'm not going to go into any more detail about that. Last time I checked, there was some space in Stacey's Zoom sessions in the final 2 sessions. That might be booked up by now. Again, you'll be able to watch them on YouTube. We'll be live streaming those as well. This is a good question, and I wish I had a better answer for it, really. How quickly do I think things will get back to normal in hospitals once more general restrictions are lifted? My due date is August, so I'm wondering what the chances are. Wouldn't we all love to know when we're going to be going back to normal? All I can say is, we would all love to go back to normal as quickly as possible, especially for those working in the hospital. There's so much extra pressures generally just because of the virus, the risks to the staff, and also things like not having the partners there and things like that. As I would say before, the world's entirely back to normal, we will already have lifted some of those restrictions, I would imagine. Things like allowing partners to come onto the labour ward for a longer period of time. I don't think that would happen a bit earlier on in loosening things up, but I can't give you a more accurate date than that. I would love to think that by August we'd be mostly functioning in a normal way, but we really don't know at this time, especially in the UK. They haven't really given us any indication about the exit strategy for this situation. Are midwives and maternity anaesthetists kept separate from COVID nurses and anaesthetists to avoid cross-contamination? No, we just do not have enough anaesthetists. They would love it. I'm sure they would love it. A lot of the anaesthetists would love to be able to just hang out on labour ward because actually it's a much easier environment for them right now than being on the intensive cares. And I know that they enjoy to come to labour wards and to do the epidurals and help women have a more positive birth experience. It's just not possible to separate them. If they are seeing any COVID patients, then of course they would be wearing PPE and doing absolutely everything they can to reduce the spread. In general, they wouldn't usually switch between shifts on, for example, intensive care and the labour ward. However, we often, even outside of this kind of crazy time, we're often calling on anaesthetists that are covering other parts of the hospital, because the delivery units can become at certain times very busy. We might have a number of emergencies going on at one time, and anaesthetists come to help each other out from different areas of the hospital. So I'm afraid there isn't any way really of separating the people that are looking after coronavirus patients and that aren't, except maybe if you are giving birth in a hospital that has very, very few cases, in which case maybe they could preserve certain member of staff to just interact with those. But most of the hospitals, especially in kind of London areas where there are a lot around at the moment, it's not really possible to separate them. Okay. This question, I hope I've answered it so far, but will my partner be allowed to hold the baby before they must leave? Again, it will depend on exactly the rules in your hospital, but if they're allowed to stay for an hour or so, then of course we would hope that they would be able to have a bit of a cuddle before they go. Can't guarantee, but I would hope that is the case at the moment. Okay, I am due in 3 weeks. My biggest fear is catching coronavirus from a hospital during birth. Do you know what precautions the hospital are likely to have in place to prevent this? Sorry. I'm trying to show you back to this slide near the beginning. But it's the same for the hospitals really as for everybody, how we're going to reduce the spread of the virus, washing our hands. I mean, you just have to look at social media to see how, how the healthcare staff at the moment are complaining their hands are so dry because they are washing their hands so frequently, way more frequently than usual, in between absolutely everything that they're doing. They are trying where possible to maintain the distance, avoiding touching their eyes, nose and mouth. And of course, PPE, so that's the personal protection equipment, really, really important at the moment, but it's difficult to say. There's not really any extra precautions than that they can take, apart from where possible, separating all the coronavirus patients. So in hospitals that only have a few, they would put any patients that have got active coronavirus into their own room, for example, as opposed to being in an open bay. But if they have a lot of people with coronavirus, then they probably instead be putting putting certain bays or certain wards, designating them as coronavirus wards, rather than having people that have it and don't have it mixed up together. Certainly in the UK and most first world countries, when you're in active labour, you'll be in a room of your own. You won't be on a ward with other people when you're in labour giving birth. But yeah, those are all the precautions that I can think of that we're taking right now. So this question is, what happens after birth? Will I be moved onto an open ward, and how long will I have to stay in hospital if the birth has been straightforward? As I mentioned earlier, our hope would be that if everything's been straightforward, we would aim to get you home as soon as possible. It's something that kind of makes me a little bit nervous, because I completely understand that actually being in hospital for a few hours or even overnight has got its benefits. So there's certain things that I would say, just make sure you get some support before you leave, but they would have the intention of getting you home sooner rather than later. So a few hours probably after birth if everything went well. Make sure you get support with things like breastfeeding or feeding your baby in general, making sure you've asked all your questions about any wounds that you've got, tips for making sure that you're looking after that well. But instead of staying in hospital longer, the hope would be that you're getting support after you go home instead. So from the community midwife services, for example. Okay, please can you explain in more detail the induction after 41-week appointment? Asked COG update. Does that mean that if you're 41 weeks, you have an induction against your will? Again, I hope I explained that earlier, that it doesn't mean at 41 weeks we're going to be telling you you have to have an induction today. It's probably a little bit after that. It will just depend on the hospital's policy themselves. But no, nothing should ever be done against your will. In our course, we've got a bit of a in our kind of handbook, as well as in the lectures, we talk about what you can ask, questions you can ask when someone's recommending something to you. So a tool that you can use to make sure you understand what is being suggested to you and whether or not you think it's the right thing for you to have at that time. But no, nothing should be done against your will. You should always be able to ask as many questions as you want, and you of course have the right to refuse it. It's just difficult at this time to be arranging people to come backwards and forwards if you're not sure, if you want to give yourself more time, that sort of thing. It is difficult, but they might be able to do some of that over the phone with you. Okay. Will we have to wear a mask during labour? This could be more stressful, trying to do the hypnobirthing breath and having a mask. I would say it's a really good question to ask Carrie tomorrow, and I'll pass that question on to her just in case you're not around to ask that question. But not routinely, no. We wouldn't be expecting you to wear a mask during labour. In the UK at the moment, we're not really recommending people widely wear masks. If you do have active coronavirus infection, then you probably will be asked to wear a mask, and also if you do have a cesarean section, at that time you'll probably have a mask put on you. It might be more stressful, but it shouldn't stop you from doing the hypnobirthing breathing. If anything, it kind of having the mask there is even more reason to try and take deep breaths, but Carrie will be able to help you with that tomorrow. What is the advice for childcare of other children if my hubby comes with me in childbirth? Where is the safest option for my 3-year-old to stay? One set of grandparents are shielding as high risk, the other are still working as key workers, so neither seems appropriate. Oh, I'm sorry, that sounds like a really difficult position to be in, and I can completely relate and understand. And it's just one of these big issues at the moment that we have. It's a personal question there, but I'm sure other people are in the same situation. We're telling you, not to see anybody else, especially grandparents, but then, who's going to look after your child? And I think if you don't have any regular childcare, certainly you do not want to be bringing your child into hospital with you. So I think that might be a situation in which your husband wouldn't be able to come with you. They should probably look after your other child, but it's a decision that you have to make, and based on your own circumstances, on the circumstances of the people that are around you as well. Maybe if we kind of get widespread testing in the near future, and someone's been tested, that might kind of open up a few extra options, but at the moment I can't think of any kind of better advice than that, I'm afraid. If you have a straightforward vaginal birth, how early could you potentially be discharged home? Normally, we would, sort of outside of coronavirus, we talk about a 6-hour discharge as for somebody who has a very straightforward vaginal birth, especially maybe if you've had a baby before and you're used to things like breastfeeding and you're quite comfortable in getting you home after 6 hours. However, I've actually heard in this time at the moment, I've heard sometimes of it happening even sooner than that. So say kind of 2-3 hours after birth, if everything is completely well. That probably won't be for the majority of people. A lot of people have reasons that they might need to stay in for a little while longer, but we would certainly be aiming to get you home sooner rather than later. Okay, this question here is about vertical transmission. So have I heard anything more about it? I recently updated on my Instagram, that would have been, that there was one case in China, but very limited published research. I mean, that was only a few days ago. And no, I'm not aware of any more research that's come out since then. I really think at this point, it's not worth giving too much extra thought to. So for anyone that doesn't know and what we mean by vertical transmission, that's where we now do believe that it's possible that the coronavirus, if you were to catch it whilst you're pregnant, that the virus can cross the placenta across to the baby, because there was this case where a baby was born in China to a mum who had an active coronavirus infection, and when the baby was born, the baby tested positive for coronavirus and was showing signs that the baby was also fighting the COVID-19 infection at the time they were born. As I understand it, the baby did fine, and from everything that we've got so far, we believe that even newborns that catch this virus, there's not really any increased risk, there's not any increased concern for them. So although yes, we're saying the virus can pass from mum to baby, at this point we're not aware that it will actually cause harm to the baby, so I wouldn't give too much worry or pay too much attention to that right now. I'll obviously be keeping an eye out for any more updates on this issue. Okay, what about if your partner has a common cold, sneeze, but no cough? What we really want at the moment is for everybody to just be sensible. Please, we completely understand that you would want your partner to be with you, but please also try to be responsible for the other people that you're going to be exposing. So the other women, vulnerable women in labour or pregnant that are in the hospital, and obviously the healthcare staff. I think if your partner is unwell of any form, because we know the symptoms of coronavirus are so general, they can be sneezing, they can be just feeling run down, fevers, muscle aches, things like that. I think if there's any suggestion that they might have some mild symptoms of the virus, that still means that they are very likely to be infectious and to be spreading it around. So please, if you can, try to be responsible and don't just try to find ways around the system. If you think they're unwell, I would say they shouldn't be coming to the hospital. I have heard that anaesthetists are very busy in ITU. Is there a risk that anaesthetists won't be available to assist on labour ward, e.g. for an epidural? So, yes, this is true. They are very busy in ITU at the moment. However, we usually, wherever possible, have separate anaesthetists who cover our labour ward. This is mainly in the UK, but I assume it's the same elsewhere. We have either one or two labour ward anaesthetists that are present and available, because in the maternity units, we'll have operating theatres in case we need to do things like emergency cesarean sections or instrumental deliveries, anything else. And so we need to have our own designated anaesthetists that help with that. And they also are the same people that will be providing epidurals. So we would hope they wouldn't be tied up with things on the intensive care. They should be separated from them. It is an extreme time, and the anaesthetists will always be trying to help each other out because they will have a special skill that if they need extra people to, for example, do intubation, whilst other doctors could assist them on the intensive care, only anaesthetists will be able to carry out that specific procedure. So they might have to go along and help out, but generally there will be designated doctors who should remain on labour ward or be there for the labour ward cases. And the emergencies, they would definitely be available for, should be available for, and that would be things like emergency cesarean sections, emergency instrumental deliveries. An epidural that's just being done because of you want it for pain relief, absolutely, it's very important, but it isn't considered an emergency. It's something we go into again in a little bit more detail in our main course about the reasons that you may not be able to get an epidural when you ask for it. But so yes, it is possible that you may not be able to have it if there are other emergencies going on labour ward, or if the anaesthetists have been called away, but generally they should be available to do them for you kind of in the same as normal, because that number of staff shouldn't have changed ideally. Okay. So you say that the birth partner must leave straight after birth. How likely is this to be? I hope I've already answered that question so far. Okay, after giving birth in the postnatal period, are you no longer considered vulnerable in relation to coronavirus? So that's because, yeah, in the UK, and it's not the same, I think, in other countries at the moment, we are calling pregnant women vulnerable, basically because we don't fully understand at this point the effects that catching coronavirus will have on you and on the baby. Although we don't think at the moment that there is any severe effects, we don't know fully. We know that pregnant women, when they do catch respiratory infections especially, can get complications of that can make them very unwell, which is why we are treating pregnant women in the same category of vulnerable patients as, for example, people that have things like asthma or anything that affects their immune system and their ability to fight infections. After you've given birth, then you're not pregnant anymore. So no, you wouldn't specifically be considered vulnerable in that sense. But of course, you've got a vulnerable person, which is your newborn, who children, especially a newborn baby, would be considered vulnerable. Again, we don't think that they're any more likely to catch coronavirus or be at any increased risk for complications of it. But you should all be kind of isolating. If that's what this question is kind of aimed at asking, yes, you should remain in isolation. You shouldn't have any visitors at home, and that's because we should all be avoiding any additional contact at this point with anybody from outside of your household. Okay. If Group B strep has been picked up, will mother and baby still be kept in for observation for 24 hours after the birth? So Group B strep is a bacteria that lives inside women's vaginas. It doesn't cause any harm or infections to a woman normally at any other point in her life. It's something that kind of comes and goes, might be there 1 month, might go away, might come up again. It matters to us whilst you're pregnant, because if you have Group B strep, during labor, that can be passed on to your baby, and it has been associated with things like sepsis and meningitis in babies. So it doesn't mean to say everyone that has Group B strep, their babies will get these infections. It's more the other way. In the very, very, very rare situation where your baby may get a severe infection, the bacteria that we might find associated will have been this Group B strep. So if we have found that mum has this infection, then we tend to observe, we would give you antibiotics during labour. It doesn't necessarily mean anything for mum, but yes, baby will probably be under observation, especially if they haven't received the full course of antibiotics that they need. It's a bit of a difficult question to answer specifically how long we would keep an eye on both, and that probably vary depending on different trust policies or hospital policies there. But it's worth discussing with your midwife if you know you're GBS positive. But the main thing is not to wait at home too long if your waters break, or if you know that if you start to go into labour, you would call early, let them know that you've got Group B strep, and they'll probably advise you to come to hospital sooner rather than later. Okay, this will probably be the last question that I will take tonight. So I'll answer this one here. If you do end up having a C-section, how long is it that you'll likely stay in for? So for most people that have a C-section, especially if it's an elective, so a planned C-section, or even an emergency cesarean that goes well, there's not any unexpected complications, then you would probably stay in hospital for 1 night, maybe 2 nights. And that's kind of normal for outside of the coronavirus pandemic, but you would not expect to be going home any sooner than, staying in for 1 night, even during this pandemic. Possibly 2 nights. It all kind of depends on how you recover, how quickly you're able to get up out of bed, how your pain is controlled, how your bleeding is. Any of those other things might keep you in hospital for a little bit longer, but generally, yeah, it'll be 1 or 2 nights in that situation. Okay, so I hope I've tried to answer as many questions as possible, and I really hope that you guys found that useful. Sorry, I haven't had a chance to look at YouTube to any of the questions coming in, but thank you for any comments or questions that you've been leaving there, and we'll check over them. We'll be running this course for 4 weeks. So tomorrow is going to be Carrie, who is giving her session on hypnobirthing and how to use the hypnobirthing techniques at this time of the pandemic. We've also got Leah, who's going to be giving us a full-length yoga class live on Friday. So again, that will be, if you haven't already got a place on that, they'll all be live streamed to YouTube. And then finally on Sunday, Stacey will be giving her introduction to breastfeeding at this time, and a little bit about what support you can expect after you go home after birth. So again, think of more questions, keep sending them in if you're in the Zoom chats, or leaving them as comments under the YouTube. For anyone that didn't manage to attend, tell them about the course. It's going to be running for 4 weeks. So again, after Sunday, we'll start again on Tuesday. It'll be me again for the next 4 weeks. So tell people that they can still continue to sign up. And it's going to obviously stay free, and we're just trying to get as much information out there that is useful to you guys. So I hope you all stay safe, stay home, and save lives. But yeah, more than anything, just look after yourself and your families at this time. And thank you so much for joining.